COVID-19 briefing. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Les porte-parole aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'Honorable Blaine Higgs, Premier ministre du Nouveau-Brunswick. Dr. Russell.
Thank you, Bruce. Merci, Bruce. Bon après-midi à tous et à toutes. Good afternoon, everyone. Since our last briefing, another New Brunswicker has died as a result of COVID-19. This was an individual aged 60 to 69 residing in Zone 2, which is the St. John region. We have now experienced 34 deaths from the virus since the pandemic began last year. While our losses have been relatively few compared to some other jurisdictions, we are collectively diminished by each life lost due to COVID-19. Chacune de ces 34 personnes avait une vie, une famille et des êtres chers qui les aimaient. Leur mort a laissé un trou béant dans leur vie, tout comme dans la nôtre d'ailleurs. Nous vivons dans une petite province et il existe des liens entre nous tous. Lorsqu'une famille est ainsi endeuillée, nous partageons tous son deuil. I wish to offer my sincere condolences to the family and friends of this individual at their time of sorrow and to remember all the other lives we have lost to the virus over the past year. With each death we experience, we are reminded of the seriousness of the pandemic. We are reminded again of the urgency of following public health guidance and advice. And we are reminded of the importance of our mission to keep New Brunswickers healthy and safe. Le secteur d'Edmundston et Grand-Sault est le secteur d'Edmundston est en confinement depuis maintenant 12 jours et les progrès réalisés en vue de se sortir de cette éclosion sont lents. J'ai bon espoir que nous serons bientôt en mesure de lever les restrictions imposées en période de confinement si la tendance se poursuit au cours des prochains jours. Bien que le nombre de nouveaux cas fluctue chaque jour, nous surveillons de près la moyenne de cas sur une période de 7 jours. Cette moyenne nous donne une idée plus précise de la tendance générale. This number is slowly going down in Zone 4, which is a positive sign. At the beginning of April, the rolling 7-day average of new cases in Zone 4 was more than 10. As of yesterday, that number was 5. This shows that some progress is being made. Notre objectif consiste à obtenir une moyenne de 3 cas ou moins sur une période de 7 jours, sans connaître une diminution du nombre de tests de dépistage subis. Les données doivent aussi prouver que le confinement obtient les résultats visés en ce qui concerne la prévention de nouveaux cas attribuables aux déplacements au sein de la population. Et je peux vous montrer un portrait de la zone 4. So this graph shows why we remain concerned about the Edmundston situation. Each dot in this image represents a confirmed case with the lines showing connections between the cases. You can see that we have 3 large clusters of cases where we have confirmed linkages. There are also several smaller groups and a large number of dots with no connection to any other known case. To lift the lockdown, we need to see the elimination of new cases from community transmission as well as those brought into the area through unnecessary travel. To achieve these goals, it is very important that everyone who is asked to self-isolate do so away from others in a separate dwelling so that the virus does not have the opportunity to spread. This is our best chance to succeed right now and make sure that we don't continue to put pressure on the hospital system where we have patients hospitalized and in ICU at the moment. It means that family members should not pick you up from the airport. They should not handle your dishes from delivered meals. The risk is just too high of infecting your loved ones and the individuals with whom they work and other contacts. And as you know, the variant that's involved right now in Zone 4 is the UK variant, but we are seeing variants in other zones, including the South African variant, and we are very, very, very concerned about the arrival of the variant from India that has appeared in Quebec and other provinces in Canada. Santé publique continuera à surveiller et d'évaluer l'éclosion dans la zone 4. Nous avons recommandé au cabinet que le secteur d'Edmundston demeure en confinement et que la situation soit réévaluée le lundi 26 avril. À cette date, nous réévaluerons également la situation de la région de Grand-Sault-Drummond qui demeure pour le moment au niveau d'alerte orange. I want to thank the people of Edmundston for their determined efforts to help us reduce the scope of this outbreak. It has been a very great collaborative effort, and I'm very, very impressed with the work that is being done from that entire community. Tomorrow, I will be doing a live stream talk with Dr. John Tobin, Head of Family Medicine in Zone 4 with the Vitalité Health Network. We will be talking about the situation in Zone 4, as well as our vaccine rollout. And if you have questions for us, please submit them through the government's Facebook page. Aujourd'hui, Santé publique annonce qu'il y a 19 nouveaux cas de COVID-19 au Nouveau-Brunswick. Il y a 11 nouveaux cas dans la zone 4, sur la région d'Edmundston et de Grand-Sault. Ce chiffre comprend 9 cas confirmés au pavillon Beaulieu, un foyer de soins spéciaux situé à Grand-Sault. Il y a 3 nouveaux cas dans la zone 2 qui comprend les comtés de Saint John, Kings et Charlotte et sont tous liés à des voyages à l'extérieur de la province. Il y a aussi 2 nouveaux cas dans la zone 3 sur la région de Fredericton et de la vallée de la rivière Saint-Jean. L'un de ces cas est directement lié à un voyage alors que l'autre fait toujours l'objet d'une enquête. Il y a 2 nouveaux cas dans la zone 1 sur la région de Moncton et du sud-est du Nouveau-Brunswick qui sont tous les deux liés à un voyage. Il y a aussi un nouveau cas dans la zone 6, soit la région de Bathurst et de la péninsule acadienne, qui est lié à un voyage. Il y a maintenant 146 cas actifs de COVID-19 dans la province. En tout, 15 personnes sont hospitalisées à l'heure actuelle, dont 5 aux soins intensifs. Today, Public Health is reporting 19 new cases of COVID-19 in the province of New Brunswick. In Zone 4, which is the Edmundston-Grand Falls area, there are 11 new cases, and this includes 9 confirmed cases at Pavillon Beaulieu, a special care home in Grand Falls. In the Grand Falls situation, apparently, while there are many infected, effects have been greatly reduced. The virus can still be transmitted, but this has shown that vaccination is working. And by that, we do know that about 40% of the population is now vaccinated in that area, which is great. It doesn't mean that the transmission won't still occur, but it does mean that those people who have been vaccinated and who do become infected will have a very, very, very low likelihood of needing to be hospitalized or admitted to ICU. There are 3 new cases in Zone 2, which is St. John, Kings, and Charlotte counties, all of which are related to travel outside the province. There are 2 new cases in Zone 3, which is the Fredericton and St. John River Valley. One of these is directly related to travel, while the other is under investigation. There are 2 new cases in Zone 1, which is Moncton and Southeast New Brunswick, both related to travel. There is also 1 new case in Zone 6, which is Bathurst and the Acadian Peninsula, which is travel-related. There are now 146 active cases of COVID-19 in the province. There are 15 individuals now in hospital, including 5 who are in intensive care. I ask again that you offer your thoughts and prayers for these New Brunswickers, as well as the 750 people who are self-isolating to help us slow the spread of this disease. We remain very, very concerned about outbreaks of COVID-19 in communal living locations because the speed with which the virus can move in these settings. This week, our prompt teams have been activated to address new outbreaks at Pavillon Beaulieu in Grand Falls and at Murray Street Lodge in Grand Bay Westfield in Zone 2. Our teams are working with staff and residents to enhance infection control at these facilities, and they will continue to support these homes for as long as necessary. And I do want to thank our teams for their diligence in helping to make these residences safe. Santé publique continuera de surveiller ces éclosions de près jusqu'à ce que 2 périodes d'incubation complètes se soient écoulées, soit 28 jours sans nouvelle infection. Public Health is today declaring an end to the outbreak at Résidence Roland-Long in Edmundston. This particular outbreak was quickly brought under control because the residents were all moved to hotel rooms where they were isolated from one another and were under 24-hour supervision. They needed to be moved because they could not self-isolate adequately within the home. The residents have now all received negative test results and have returned to the residence. Municipal elections will be held across New Brunswick on Monday, May 10th. Like so much else in the past year, this election campaign will look and feel different from what we have experienced in the past. Public Health has provided guidelines to candidates on how they can conduct their campaign safely, and information is available on the Elections NB website. And I would like to remind everyone involved in this year's election to make themselves familiar with those rules so that everyone will remain healthy and safe. Santé publique a encouragé les candidats à utiliser d'autres moyens pour faire passer leur message, comme les médias sociaux et le dépôt de dépliants. Candidates in areas at the yellow and orange alert levels may choose to campaign door-to-door, but if you do, please follow public health guidance. Wear a mask, maintain 2 meters of physical distance at all times, and do not go into voters' homes. These measures will help ensure that this election is conducted without further spread of COVID-19. We are making some progress against COVID-19 in New Brunswick, but to maintain this momentum, we must continue to be on our guard, especially with the variants that we're now dealing with. Again, these are very, very different than the strains that we saw before the variants arrived. This virus does not move by itself, and if we don't move either, then neither does COVID-19. L'approche du printemps après un long hiver où ils ont dû se plier aux restrictions de santé publique, les gens veulent bouger. Je les comprends. Cependant, si nous restons près de chez nous et prenons les mesures requises pour nous protéger et protéger notre famille, nous aurons plus de chances de contenir la propagation du virus responsable de la COVID-19. By standing our ground for just a few more weeks, I mean, we are probably about 10 weeks away from having everybody vaccinated with their first dose in this province. We will get through this. We just need to get through the next 10 weeks. So please take care of yourselves, look after your community, and the only way that we will get through this and continue to do so is by doing it together. Thank you very much.
Good afternoon. Bonjour. Yesterday, Marcia and I were saddened to learn that another person in our province has passed away as a result of COVID-19. On behalf of all New Brunswickers, we would like to share our sincere condolences with their loved ones. Our thoughts and prayers continue to be with you during this difficult time. Pour l'instant, il est encore plus important que jamais de continuer à suivre les conseils de la santé publique et à respecter le raté obligatoire afin de ralentir la propagation de la COVID-19. Most residents have been doing their part and following the rules. But I have been disappointed by a few reports of people blatantly violating regulations by failing to wear a mask, participating in large gatherings, and failing to self-isolate properly when required. We are more than a year into the pandemic, and there's no excuse for this behavior, especially when we are so close to the finish line. These actions are dangerous and put others at risk. While peace officers focus on education, I want to remind all New Brunswickers that violating the emergency order can have serious consequences, and this does include substantial fines. Juste cette semaine, des contraventions ont été données à la suite d'un rassemblement dans la zone 4, où des participants ne respectent pas les règlements de la santé publique. Between April 9th and 15th, officers conducted 67 checks to ensure people in Zone 4 who were required to self-isolate were doing so properly. They only found 2 cases where people were not complying. We know it only takes 1 case to cause an outbreak. Peace officers will continue to check on people who are self-isolating throughout the province and will follow up on all complaints that they receive about violations of the mandatory order. Il faut absolument que toute personne qui a reçu un ordre d'auto-isolement de la part de la santé publique d'un fournisseur de soins de santé ou d'un agent de l'APA suivent des consignes correctement. Cela veut dire qu'il faut rester à la maison pendant 14 jours et éviter tout contact avec les autres. Si vous ne pouvez pas éviter les contacts avec les autres personnes de votre ménage, tous les membres de votre ménage doivent s'y isoler pendant 14 jours. While self-isolating, do not spend time in the same room with another person in the household. Do not eat together or do not share a bathroom. We have seen cases where an entire household becomes infected, sometimes with tragic results. We are currently looking at putting additional measures in place to ensure people are complying with self-isolation requirements. Peace officers are also conducting random checks in Zone 4 to ensure people are following the rules and will issue tickets when the rules are not being followed properly. The small number of people who are disobeying the rules right now are putting others at risk. While prolonging the amount of time, we must all wait until we can enjoy all activities safely. In recent months, we have made significant progress with our vaccine plan. As of today, more than 196,000 New Brunswickers, nearly 30% of the population aged 16 or older, have received at least one dose of the vaccine. Another 95,000 of those doses have been administered at a pharmacy, and I want to thank pharmacists across the province who have adapted quickly to help the vaccine rollout go as smoothly as possible. In fact, as Dr. Russell said, we need 10 more weeks. The current supply and predicted supply of vaccine would see us doing up to 45,000 a week through May and June. This will get us to the levels we need to have summer in New Brunswick. But let's not blow it in the process. Let's make sure that we follow the rules and we get through this next 10 weeks and we can manage through the rest. More than 40% of the people overseen in Zone 4 have been vaccinated so far, and we can already see the impact of that vaccine level. Bien qu'il y ait encore des cas de transmission, nous voyons beaucoup moins de cas de maladies graves dans la région de Grand Sud. Il s'agit d'une bonne nouvelle, mais nous n'avons pas baissé la garde. While vaccinations have been offered to workers in all of the province's long-term care facilities, not everyone has chosen to get their shot. This is a real concern, as just yesterday, 2 new outbreaks were declared in special care homes located in Grand Falls and in Grand Bay, Westfield. Staff in these facilities are doing essential work by caring for vulnerable New Brunswickers, and I want to thank them for the crucial role they have played and continue to play. I also want to encourage them to take steps to protect themselves, as well as the people they care for. To date, while around 92% of long-term care residents have received their first dose, only 59% of long-term care workers have chosen to be vaccinated. This in comparison to more than 90% of staff working in the regional health authorities have had their first dose of the vaccine. It is essential that in the coming weeks, more long-term care workers choose to get vaccinated. Truck drivers are another crucial group that we must protect so they can continue to perform the essential role that they have performed throughout this entire pandemic. There are approximately 3,200 New Brunswick truck drivers who regularly cross borders as part of their essential service. Tout au long de la pandémie, nous avons compté sur alors qu'il apporta des biens essentiels dans la province. Ils sont admissibles à la vaccination depuis le 24 mars et j'encourage tous les camionneurs à prendre un rendez-vous pour recevoir leur première dose de vaccin dès que possible. Just over a week ago, 29% of New Brunswick truck drivers who regularly travel across borders had received their first dose of the vaccine. To date, 49% have had their first dose, and I thank each and every one of them for taking the time to do so. I know their schedules can be unpredictable, which is why we are working closely with the Atlantic Provinces Trucking Association to make vaccines as accessible as possible. Earlier this week, we created a dedicated phone line for New Brunswick truck drivers to contact us, or we contact them directly for assistance in booking a vaccination appointment. The number is 1-833-724-0088, and it has been shared with the Trucking Association and employers in the industry to ensure drivers are aware. I have also reached out, as many of you know, to the Governor of Maine to see if there's an opportunity to allow New Brunswickers who cross the border regularly for work to get vaccinated while in the state, similar to the agreement Manitoba and North Dakota announced earlier this week. Nous sommes privilégiés d'avoir accès aux vaccins qui peuvent aider à nous protéger d'un virus dangereux et potentiellement mortel. I'm optimistic that we will be able to take advantage of surplus vaccines as they become available in Maine, and we continue to be optimistic because we both have the same interests. We both want our borders open, and the sooner we are vaccinated to the same levels necessary, the sooner that will be a reality. As more groups become eligible to receive the vaccine, I hope New Brunswickers will make an informed decision and consider what they can do to keep themselves and the people around them as safe as possible. Throughout the pandemic, New Brunswickers have stepped up and done their part and continue to do so. It wasn't any surprise to me that more than 20 people with healthcare experience have answered the call we put out earlier this week to travel to Ontario to assist with their COVID-19 response. I want to thank these people for offering to help a province that has been hit so hard with the virus. You are going above and beyond, and I know the people of Ontario appreciate your willingness to help provide essential medical services at this very critical time. You indeed make New Brunswickers proud. La grande majorité des gens de New Brunswick donnent un exemple positif. La plupart des gens portent des masques, évitant les rassemblements et s'auto-isolant de la bonne façon lorsque cela est nécessaire. Thank you for doing the right thing, even when it is difficult to do so. Do not be discouraged by isolated incidents of rule breaking and bad behavior. We will work with all individuals, as we must. We all need to speak to each other. We all need to encourage each other to just be patient, to be diligent, and just help us get through this next critical 10 weeks. Even though we see outbreaks all around us, and even though we have concerns that remain and continue here in New Brunswick, we can do this. We've been exemplary so far. We can deliver at the end of the day and be proud of what we've accomplished together. We need to remember what we've been saying since COVID-19 first appeared in our province. We are indeed in this together. We are indeed working like never before as a team. By taking care of each other and by thinking about how our actions impact our family, our friends, our neighbors, and our colleagues, we will make it through this pandemic. We will come out the other side stronger and better. Thank you. Merci.
Thank you very much, Premier. Dr. Russell, merci beaucoup, Monsieur le Premier Ministre, Dr. Russell. We'll now proceed with questions from members of the media. Each reporter will have one question. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser votre question dans la langue officielle de votre choix. Chaque journaliste aura une question. Voulez-vous assurer de désactiver le son de vos micros? Andrew Waugh, Brunswick News.
Good afternoon. My question's for the Premier. Premier, I'd like to get your thoughts on the international borders and the flights continuing to come in from COVID hotspots like India. What do you think the federal government should do, and how would you rate their performance in controlling the international borders throughout the pandemic?
Well, I think response time has been critical, and at this time, there's without any doubt in my mind that the international borders to hot zones like India should be closed. These flights should not continue to come into Canada. And I think, we've been talking with public health, and we're assessing just how we manage that if they do continue, because it's the response time is critical. We've known that here in the province, and it's been certainly a great component to the success we've had to date. And that's what we need from the federal government. We need a rapid response to this situation.
Thank you, Premier. Travis Fortman, Global TV.
Hi there. I was just wondering if you had numbers on how many New Brunswickers have volunteered to go to Ontario to help out there.
At this point, it's around 20.
Thank you, Mr. Fortman. Laura Lyle, CTV.
Hi, thank you, Bruce. This question would be for Premier Higgs. Premier Higgs, can you tell us what has come out of those conversations that you started with the governor in Maine, and what, if anything, you're hearing from their side?
Well, initially, so my call went out to Governor Mills, and I haven't spoken to her directly. We talked to her office directly. My staff talked to Governor Mills' staff, and basically they said that they wanted to entertain this conversation later, but right now they weren't in a position to do so. And, you know, later is in terms of days or a week. It won't be months. But I think what we've seen with a major increase in our vaccine supply, almost doubling, that, you know, that's going to is now projected to happen over May and June. And I think what we've seen in the U.S. is their willingness. President Biden has certainly said that he wants to look at Canada and provide surplus doses to Canada. And our nearest neighbors, certainly the state of Maine, would be part of that. And they gave every indication that although they couldn't entertain it right now, it would be something they certainly would be willing to look at in the near future.
Thank you. Marie Sutherland, CBC.
Hi, my question is for Premier Higgs. So are you saying then that vaccine hesitancy among long-term care workers is partly to blame for the continuing care home outbreak?
Well, I'm saying it's a concern. And yes, we've had certainly some of the workers there that have tested positive. Now, fortunately, the residents, as I pointed out and Dr. Russell's pointed out, are over 90% vaccinated. So the residents, are protected, but we need to be sure that the employees remain protected. And, you know, at a roughly 65% level of vaccination, when other healthcare workers for the health authorities are at the 90+ percentile. So we're encouraging them. We need them to protect themselves because they are providing a service to a vulnerable population, and also they risk infecting others in the community, which is what we're watching so closely right now with the variant concerns.
Thank you. Vicky Hogarth, CHCO TV.
Thank you, Bruce. Premier Higgs, I'm just wondering, how does what's happening in Nova Scotia affect the reopening of the Atlantic bubble? Has there been a new date set or talked about, and do you have concerns for New Brunswick based on what's going on just next door?
Well, we have concerns for each other, and we've had numerous discussions, the other three premiers and myself, about our respective conditions in our provinces. And so, yeah, it certainly affects the bubble, but we're all talking, mid to later part of May. So we're being very optimistic in that regard. And I would say that, yes, this recent outbreak, both, what we have been experiencing for the last several weeks in New Brunswick and what Nova Scotia is currently experiencing is obviously concerning. But it's the vaccines, I continue to put our emphasis there because if we receive the vaccines that are now committed, and we have every reason to believe that will indeed be the case, and even greater, our challenge will be that is putting vaccines into arms, and I have every confidence because we have planned for this. We're ready to roll out vaccines as they arrive. We've demonstrated that we can do that, and our ability has just continued to ramp up. And we feel that we can go much higher than 45,000 a week if need be. So I would say the Atlantic bubble is still very much a reality, but we are pushing into the latter part of May at the earliest.
Derek Dubé, TVA.
Oui, la question est pour Dr. Russell ou le Premier ministre Higgs. J'aimerais savoir, vous avez mentionné en anglais que plus de 92% des personnes résidant en foyer de soins sont vaccinées, ainsi que 59%, c'est très faible, là, des employés. J'aimerais savoir le pourcentage là, de personnes qui ont eu 2 doses là, dans la population vieillissante, que ce soit dans des foyers de soins ou un peu partout, là, des 70 ans et plus.
Un moment. Do you have that address?
Alors, pour l'instant, toutes les gens dans les résidences à long terme, ils ont eu leur première dose. On va commencer à donner les deuxièmes doses dans les résidences sous peu.
Merci, Monsieur Dubé. Kathleen Jones, allnewbrunswick.com.
Hi, this question is for Senior Higgs. I'm wondering, now that 40% of the population in Edmonton has been vaccinated, when will vaccines be redistributed more evenly across the province?
Well, I would suggest the focus, and from our discussion this morning with Public Health and the COVID Cabinet Committee and Cabinet, the recommendation is that the emphasis will continue to be placed in a red zone, a lockdown zone, orange zones, the degree of severity. So this is locked down. So it'll continue to get, a priority. We've come up in the last week, we've come up probably 5% throughout the province. And so we're still rising that percentage throughout the province, but I would say the focus will continue to be to get the Edmonton region under control. And as long as it's in red, it needs to be a priority region. As long as it's locked down.
Thank you. Michel Corriveau, Radio-Canada. Michel? Alexandre Boudreau, l'Acadie Nouvelle.
Bonjour, ma question serait pour le Premier ministre Higgs. Je ne sais pas s'il peut entendre la traduction.
Oui.
Oui? Oui, OK. Je pense que vous avez mentionné tantôt de nouvelles mesures pour s'assurer que les gens respectent le confinement. Est-ce que vous pouvez élaborer? C'est quoi ces nouvelles mesures-là? De quoi il s'agit?
No, not new measures as such, but certainly an enforcement of the current measures. We just have to be diligent in every region, and particularly in the area of Edmonton and being locked down. But we're seeing cases that are appearing elsewhere. So we're going to be just a little more diligent throughout the province, and we have to have people respect that it's necessary. And at this point in time, when we're all COVID weary and we just like to be doing something else, we've got to just hang tough for the next 10 weeks. And with vaccines, the way they're planned to be provided to our province, it's really exciting to be at this level. Because if you think about a year ago or more, more than a year ago, a vaccine certainly when we just got into this, but we're not even a reality. So we're so close. We just got to get tighter following the rules. We got to get tighter ensuring that people follow the rules. And that's the program.
Thank you. Michel Corriveau.
Oui, pardon, le téléphone, j'ai eu un problème. C'est une question pour Dr. Russell. J'aimerais savoir s'il y a des mesures possibles pour encourager davantage de gens dans la région d'Edmonton à avoir le vaccin, peut-être en réduisant l'âge, quelque chose comme ça, parce qu'il semble y avoir beaucoup de places disponibles encore, entre autres, pour la clinique de samedi.
À ce moment-ci, on va continuer à offrir les vaccins à les gens qui sont dans les ranges d'âge pour notre but pour ce moment-ci. Mais certainement, on va continuer à mettre la priorité sur le zone 4 à ce moment-ci.
Merci, M. Corriveau. Tom Bateman, Brunswick News.
Hi there. I'd like to hear from Premier Higgs on this question. Data from the Health Department shows that there hasn't yet been a single case of transmission of COVID-19 from a temporary foreign worker or an international university student to the province's general population. And in my mind, this has to be because of the strict isolation requirements that require 2 weeks to be spent in a hotel or a dorm room, and kind of away from the setting that you mentioned in your address, that can lead to the tragedies like the one you mentioned with the family in a home setting. We have seen instances of the COVID-19 being passed along by non-essential travelers. And so I wonder what prevents your government from implementing stricter isolation requirements, perhaps something like a mandatory hotel stay for people who enter this province for non-essential reasons. And I wonder if the calculation is changing as we confront, faster spreading, more dangerous, more costly viruses to our healthcare system. Thank you. Bye.
Well, I think the question is certainly valid in relation to what new measures may be required to ensure isolation and enforce isolation. And giving the time of the year with, many, let's say, snowbirds wanting to return back to the province, and certainly the movement of students as well. This is under very active consideration now in consultation with public health, and what additional measures or tightening may be required. So that this is not lost, Tom, and this is something that we're meeting now daily. We had a meeting today. We'll continue to meet, and but it may become a reality. Just exactly what you're referring to.
Thank you, Mr. Bateman. Adil Ibrahim, CBC.
Thank you. Premier Higgs, how are we having so many separate travel-related outbreaks in different parts of the province? Is it only because people are not understanding the self-isolation requirements, or is there something else happening here?
Well, Dr. Russell may want to comment on this one as well, and I would say it's a combination of the above. When we talk about just greater enforcement, and it's not all about just additional enforcement in relation to new rules. It's about following the rules we have. And yes, we have seen cases where you'd say, well, if you come in by aircraft, have a car there to take you somewhere, and then you drive it, you isolate, have someone that delivers your groceries and all this, and there's certainly evidence that doesn't happen. Someone, you pick somebody up and they go, so they're negative at the time, but then they become positive and then we get in trouble. Or they go home with their family and say, well, I'm going to isolate with my family, and then the family becomes infected. So it's really, I think, we're at the balancing point right now, or the tipping point, we might say, is that how do we get the next 10 weeks in? And so rather than someone say, oh, I'm fine, I don't need to worry about this because I didn't have a problem, just assume you have a problem. And just act accordingly, and let's just hang in there for the next 10 weeks so that we can get over this hump and get back to a summer in New Brunswick. Like it might be different, but it'll be a whole lot better.
Yeah, and I will just add to that. So let's say 7 months ago, we've had great compliance throughout the entire pandemic, I have to say. So let's say we have been maintaining that compliance at roughly, for example, again, it's not the exact number, but let's say it's about 97%. Well, 7 months ago, if we had 97% compliance, we were doing excellent because, one, there were no variants of concern. Number two, the case counts all around the rest of Canada and the rest of the world were not so bad. And we didn't have people partially vaccinated who would perhaps think that they were protected when actually they're not, in the sense that they could still transmit to people who've been vaccinated. So 7 months later, we might still have the same amount of compliance, where there's maybe 97% compliance, but that 3% margin of error in terms of people who may not be compliant through no fault of their own or deliberately, either or situation, we just don't have a margin of error or a cushion now, because the variants are so much more aggressive and so much more contagious, and so the risks are much higher from that regard. But the number of cases across this country and across the globe have skyrocketed, and not only are they higher in numbers, but it's the variants, and the variants of concern are the UK, Brazil, South African, and now the Indian variant. I mean, these are very, very challenging variants to deal with, and so we're just in a totally different part of the pandemic now, and having our population partially vaccinated does protect those vulnerable populations from having severe outcomes like hospitalization and ICU admission and death, but there's a whole large swath of our population who have not been vaccinated yet, and we have to maintain our high levels of compliance until we can get everybody vaccinated. But if we could increase those levels of compliance even further, that would be great, because we're already seeing that doing everything right at this moment is still having impacts in terms of our impacts on healthcare system right now.
Thank you. Savannah,
Thank you.
Telegraph Journal.
Hi, my question is for the Premier. When do you plan on allowing property owners and family to residents into the province with a 14-day isolation? And does that answer change if those family members or property owners if they have been fully vaccinated?
So right now, we are looking across the board to come up with a plan for the spring and the summer in relation to people returning to New Brunswick. We haven't confirmed any date when we would look at property owners coming from out of province or out of country back to their location. I can only say that, given where we need to be and with our certainly level of vaccinations, we need to be in the 75% level. And until we're there, it's going to be probably unlikely that we're going to allow property owners to come back to visit until we've achieved that and they are also vaccinated. But there hasn't been a date set. It'll all be dependent on our ability to vaccinate and what we see happening around us.
Thank you. Harry Forstall, CBC.
Thank you, Bruce. Either the Premier or Dr. Russell. My question is this. You pointed out, Premier, only 59% of LTC workers have chosen to be vaccinated, very particular choice of words, versus 90% of RHA staff. Why is that number of LTC workers so low? And what do you intend to do about it, or what can be done about it?
Well, at this point, Harry, we're certainly looking at that and contacting each facility, contacting the plan to contact each individual worker and encourage them to be vaccinated. As you know, we do not have a mandatory vaccination policy, but we certainly are assisting anyone that we can in relation to, number one, be vaccinated where they are exposed themselves or exposing to a vulnerable population, essential workers, and then certainly encouraging the general public to be vaccinated. So, but in this situation, we've ramped it up with direct contact and asking, what more do we need? I mean, when you see the level of healthcare workers, to your point, and what I referenced earlier, a 90+%, it's hard to understand why another section of the healthcare profession and public service profession in long-term care would not be part of that, or they'd have kind of the same understanding. So we're encouraging not only we will contact, but our health professionals to contact, and these facilities are private facilities. We just need to make this happen, and that's our effort this week to see that change dramatically.
Thank you. David Coach, Brunswick News.
Yes, for Premier Higgs, a new report from the Human Development Council indicates that a living wage, allowing households in Moncton to cover basic expenses and also live with dignity and a decent quality of life, would be $18.35 per hour, so $6.60 higher than the minimum wage. The group says the province needs to shrink the gap in New Brunswick between the living wage and the $11.75 minimum wage, which, as you know, is tied to inflation. Do you see low wages as a problem in New Brunswick, and do you intend to increase the minimum wage?
Well, there's a study being done this year. I think it's a year coming to do a review of the minimum wage and to look at those gaps. I mean, we went on a program a few years ago to connect minimum wage with the cost of living, but obviously, that's that. So what I mean by that, in relation to what we have seen in the past few years, that's been pretty low. But in relation to what we likely will see for inflationary, we've certainly seen it in some aspects of the economy, and what we're likely to see going forward, there will be some self-correction right there. But there is a study being conducted in this next year, and we'll understand the ramifications and the gap and what needs to be done about it based on the recommendations that come out of that.
Thank you. Erica Butler, CHMA. Jacques Poitras, CBC.
Hi, good afternoon. Sorry to be off topic, but this was the only way to get a comment today. Premier, can you tell me about your meeting with the Chief of Haboneau First Nation and what do you make of his comment to me that tax sharing might be part of a possible agreement with the province?
Well, firstly, I was very pleased to have the opportunity to meet with the chief, and I certainly we discussed many issues, which I won't go through here in public, but I'm encouraged by certainly the level of interest that the chief has, not only for his community, but in the reality that the province is facing. And what I've said to the chief, what I've said to any of them, we're looking at a sustainable path forward. And right now, we don't have one. And there are a lot of factors that can contribute to a sustainable path forward and I guess, an improvement in the lives of certainly First Nations communities and their members, and in the hope and future and being together as we improve our conditions here in all of New Brunswick. So what I would say is there was tremendous alignment in our discussion, and I'm excited about the future potential of real discussion on real issues, and certainly that's what I saw evident with Chief Richardson.
Thank you, Mr. Poitras. Marlo Glass, Telegraph Journal.
Thanks, Bruce. My question is for Dr. Russell. There was a COVID-19 exposure at St. Matthew's Church in St. John on April 18th. How many people are being asked to isolate following this exposure? And is this case a variant of concern?
I don't have the exact number of people who have been contacted by public health. That's done by the public health regional staff in Zone 2. So the public health nurses would be doing that contact tracing, and we are presuming, with respect to variants of concern, we're presuming that all new cases are variants of concern, whether it's South Africa, Brazil, UK, and even now India.
Thank you. Erica Butler, are you there? If not, before we close, Dr. Russell would like to cycle back to one question.
Yes, so I'm not sure who asked it, but the question was how many of the folks in long-term care facilities have received their second dose. And about 94% of long-term care facility residents received their first dose, and we now have about 25% that received their second dose. And then about 47% of long-term care facility staff have received their first dose of COVID-19 vaccine, and 12% have received their second dose. And then when you compare that to healthcare professionals, including physicians, nurses, paramedics, extramural care, health authority staff, and other regulated allied healthcare workers, they're estimated to be vaccinated about 84%, with about 29% having now received a second dose.
Voilà la fin de notre mise à jour. That concludes today's update. Thank you very much.